This is an amazingly exciting time to be in this field. Many of us went into urology because we love the technology. We love the fact that the field was on the cutting edge of new innovations and approaching things in a different way. And it's incredibly exciting to think about what's on the horizon.
I've been at MGH for a long time. I did my training here and my fellowship in urologic oncology here and then stayed. And one of the great things about MGH Urology is that we cover really all the aspects of urology.
We have 20 full-time physicians in our group,
including urologic oncology, nephrolithiasis or kidney stones, female urology, voiding dysfunction, reconstructive urology, male infertility, and really have made a real effort to cover all areas of urology for our patients and for our residents and fellows.
Our Urologic Oncology group is a special section within our department. We have nurse practitioners, physician assistants, and a superb group of urologic surgeons.
We approach almost all urologic malignancies in a multidisciplinary manner. And that's why, and the reason why is that a lot of cancers require different forms of treatment, not just one.
One of the really neat things that exemplifies how we work together is our multidisciplinary oncology conference. So we meet twice a month, and we'll have 50 people in the room at any given time.
I'm Phil Saylor. I'm one of the medical oncologists.
My name is Mukesh Arisinghani. I'm a diagnostic radiologist.
My name is Erin Hoverson. I'm a physician assistant.
I'm one of the genitourinary pathologists here at MGH.
I'm Chin-Lee Wu. I'm one of the GU pathologists in the hospital.
I love being part of the multidisciplinary clinic. I've really become infinitely less siloed in my specialty as a result of my time in the clinic with my colleagues.
The more minds, the better, I believe, for the patient, and things that you might not have thought of, or directions in which you would not have thought the conversation would go in, often, arise in the multidisciplinary approach.
When we have folks who have a lot of breadth of clinical expertise, as well as research expertise in understanding what is the current standard of care, as well as what's coming, which research protocols are coming down the road, as well as the folks who are doing translational research, looking at new drugs and new possibilities. It allows us to really come up with a collaborative opinion as well as a collaborative game plan.
We do this for everybody. We do this for every patient, even if they're not a complicated case. Even if they're a very simple, straightforward case, we do this for everyone.
In the year 2000, 21 years ago, I was diagnosed with prostate cancer. I really didn't know anything about cancer, let alone prostate cancer.
For most patients, these are the most challenging diagnoses they'll have in their lives. There isn't necessarily a right or a wrong decision. So it's important that they have all of the available resources to really make the decision that's best for them in tackling this challenging diagnosis.
What we do is we see patients all together. All of us in room with a patient simultaneously.
They work as a team, and it's like a football team. And I felt complete relief in their hands. It just fills you up with confidence knowing that they're going to give you the best shot at living the longest.
Science has moved very quickly, and technology and new medications have changed the way we look at patient care.
Many of us here at MGH Urology have transitioned our prostate biopsy program and practice to the transperineal approach, and mostly in clinic.
And we've incorporated now MRI fusion biopsies with our in-office-based transperineal approach, and the patients have really done well with it. It's a tremendous advance, we think, in getting good diagnostic information with the least amount of morbidity and risk, and that will really inform these patients as to the right choices, should they treat their cancer or not, and we'll have really accurate information about exactly what we're dealing with because of this comprehensive approach. I love being at Mass General because this is an amazingly diverse place. It's so important to have the diverse point of view, the feeling of inclusion, and I really feel very proud of how well everyone is embraced at Mass General, and particularly in our department. People are welcomed, people are respected and celebrated here.